When measuring intake and output, or I and O, first assess for signs of fluid imbalance, such as changes in blood pressure, heart rate, or skin turgor. Also explain the need for I and O measurement and assess the patient's and her family's ability to participate if appropriate.
Mrs. Pinnell, your blood pressure and your pulse are really good. And it's important that we keep track of your intake and your output. Everything you drink and eat, we're going to be measuring. You want to check your skin turgor. Very good.
Everything's okay?
Everything's good.
Thank you.
At scheduled times throughout the day, measure and record all fluid intake. Include all liquids consumed with meals, noting at eye level the amount of fluid remaining in the container and subtracting it from the full serving. Remember to include the fluid in gelatin, custard, ice cream, popsicles, sherbet, and ice chips. Note that 100 milliliters of ice chips equals 50 milliliters of fluid. Also include liquid medicines, such as antacids, as well as fluids taken with medications.
Thank you.
Hi, Mrs. Pinnell. I'm here to check your IV.
If the patient is receiving parenteral fluids, blood components, total parenteral nutrition, or tube feedings, measure and record these amounts too.
Everything looks good.
I'm happy. Good.
Next, measure and record all fluid output. If a urine hat, commode, bedpan, specipan, or urinal is used, instruct the patient and family to call you to check and empty it after each use. For monitoring purposes, also ask them to notify you about any incontinence, vomiting, or excessive perspiration, and tell the patient that you will monitor any Foley catheter drainage or wound, gastric, or chest tube drainage. Mark a graduated container with the patient's name and bed number and use it only for her. After putting on gloves, take measurements as needed, using appropriate containers and noting drainage color and characteristics. If needed, also wear a mask, eye protection, and a gown. For a patient with a catheter, note the color and characteristics of the urine in the Foley tubing. If needed, obtain hourly measurements using a special device. For a patient with a chest tube, measure its drainage by marking and recording the time on the collection chamber at specific intervals. For a patient with a Jackson-Pratt drain, measure the drainage using a medicine cup. If she has a larger drainage pouch, use a 240 milliliter graduated cup. If the patient has output from any other sources, such as nasogastric suction, be sure to measure and record that too. As part of your follow-up care, total the I and O at the end of each shift and once every 24 hours to detect any imbalance.